just give an overview of the basic guidelines like social distancing, washing hands.
That's me.
Okay.
She's here. Okay, good.
Evelyn's there twice.
It's because I'm on the phone and on the computer trying to figure this out. I don't know if this is working. Hold on a second.
It's fine. Just
So we are live on YouTube, and Beverly will start us off.
Okay. Well, welcome to Health Talk. This evening, our program is taking a different format than we've done for the past couple of months. Well, some of us are good at it and some are not, so be patient, okay, while we navigate this together. You know, all around us, the news is all about COVID-19. Some of it is myth and some of it, they're really true facts. However, if you have not had someone close to you faced with the illness, or if not the results of the illness, such as job loss, a closed business, children having to be home from school, and of course, folks having less access to care, citizens going without food, and then of course, isolation. I can list many more results of COVID-19. If you haven't had something happen in your family yet, believe it or not, it's right here in Augusta, and it will eventually get to you in some form or not. Because as human beings, we are relational and we're all a family. So what happens to one affects the other. So again, I'd like to welcome you, our participants. We have Dr. Renee Harper, Dr. April Hartman, Evelyn Ferrara, Anna Sanchez, and of course, Pastor David, and I'm Beverly Scarlett, and I will be your moderator this afternoon. So without further ado, I'd like to read something from our Ministry of Healing. And it's, you know, sometimes things just get so bad that we think that Jesus is not around. Where is he in all of this? But I'd like to let you know that God is not neglecting us. He is with us all the time. And irregardless of whether we are the cause of our own infirmities, it is not any reason for him not to offer his help and love to you. We're all in his care. He's never deserted us, and he's always been there. Not only does he heal us physically, but most of all, he heals us spiritually. So this afternoon, we would like to present to you COVID-19, letting you know there's no reason to fear. Just know that your Heavenly Father cares and he's got you. Pastor David, would you pray for us to begin, please?
Sure. Our dear Heavenly Father, we are thankful that you are with us in the midst of the storm, that you are not indifferent to the struggles that we are facing, that you see those financial struggles, that you see those emotional struggles, the isolation that people are going through, and that you are close to us in the midst of this. And since you are our protector and our creator, we ask that you would intervene in the things that are going on in the world and bring this to the close. We are also thankful for the wisdom that you have already given to the medical professionals, and also just the compassion that they continue to show to people who are going through this illness right now. And we pray that you would bless this meeting today as well with your spirit, and that we'll be able to learn from it. In Jesus' name we pray, amen.
Amen.
Amen. Again, we'd like to welcome our viewing audience. And we would love for you to participate. You do have a button in front of you that in the event that you would like to voice your question, you can unmute your button and ask the question. And when you have concluded with your question, mute your button again. This way, the background voice will not affect what is going on. Okay? You can also submit your questions on YouTube, and Pastor David will read us your questions. Okay? So let's see if we can begin. We'll begin with, is it okay? Okay. Dr. Renee, you're on. Tell us, what is COVID-19?
All right, so the COVID-19 is the name of the clinical disease that is caused by coronavirus. This coronavirus has been around for many years, and this is a particular strain. We know so far that it originated in China, this strain, sometime in December, probably November, December of last year. The very first cases in the United States were in late January. I believe it's January 21. And the very first case was reported in the United States. So it's a respiratory illness. Somebody else is going to talk specific about the symptoms, but it is transmitted through either contact or through the airway. There is some evidence that you can get it from some hard surfaces, that it can be there for some time and also be transmitted that way. An important concept also to acquire this is that you have to think about viral load. How much of the virus do you acquire? And there might be people who just get a brief contact and don't get the disease. And right now, our mortality rate for this virus is about maybe 2 to 5% in the statistics that I've seen of cases that have done that. I wanted to share just this picture. This is from the Johns Hopkins website. They have kept up with the statistics across the nation. So we have, and they changed minute by minute almost. There have been almost 700,000 cases reported in the nation, with a little bit over 31,000 deaths. And you see, if you can see the map, that there are spots, hot spots, where there's a lot more cases, and those center on larger cities in the Northeast, like New York, also Chicago, Detroit, and then on the West Coast in Seattle and in California, and then in Miami. Now, specific to our state, this is a picture that I wanted to share. Let's see. So we have now reported 668 deaths in Georgia and about 17,000 confirmed cases. April's going to share a little bit more specific about our community here in Augusta. But there's a very good graphic. This comes from the Atlanta Journal-Constitution newspaper. They keep up with the Georgia data. And you see that in Georgia, the very first cases appeared about a month ago. And then there's been an exponential increase. Some people believe this is because we are able now to do a lot more testing. This are the testing in the red right there, and the positive cases. You can see we're doing a lot more testing, and that of course has increased the number of cases we find that are positive. This here is the total cumulative deaths. Here is in red, and then deaths reported day by day since this started about a month ago. Here's a picture of the state, and these are cases, I'm sorry, these are deaths, not cases. So you see it's affected a large portion of our state. Until recently, we had not seen any deaths from Columbia County. Now we do have some. We have had a few from Richmond County for a few days now. But the big centers in Georgia have been Atlanta, all the counties around Atlanta, and then of course Albany. We all know that there's been a big rise in cases and deaths in Albany. So having said that, I'm going to do stop share, pass it on to the next speaker.
So what I was going to talk to you a little bit about is some of the symptoms that you see. And one thing that they found is they really don't know. Just like with the flu, some people may have fever and a headache, and other people may have vomiting and diarrhea. It kind of depends on how it hits you. But the one thing that pretty much is going to determine if you end up being hospitalized or not is going to be if it affects your lungs. So if you get pneumonia and you start coughing or get short of breath, that's the #1 reason that you need to go to seek help immediately. It helps to know if you have it, because then you can make sure that you're not spreading it to anyone else. So if you have a cough, a fever, anything like that, there is a hotline that you can call and find out if you need to be tested. Now, one of the things you've probably been hearing on the news over and over and over is test, test, test. And you can see that we've really increased the number of tests that we're doing. And Augusta University is actually one of the testing places for the whole state. The problem is, initially it was we didn't have the tests themselves. So now we have lots of tests, but we don't have the swabs and the reagents that we need to do the tests. So we have the machines, we have the tests, but we don't have what we need to collect the samples to run the test. And so that will be coming soon. I expect that they expect us to get a shipment sometime in the next week, which will enable us to really expand the amount of testing we're doing, because the only way we can stop that curve is to test. And so it's kind of been back and forth. It's like, okay, we have tests, let's test, but then wait a minute, we ran out of swabs, so stop testing, and it's kind of gone back and forth. So right now, because we're in short supply of some things, what you're finding is the only people they're really testing right now is if you're going to be admitted to the hospital, if you're short of breath or you're having any breathing problems, they're going to test you. If you're a healthcare worker, they're going to test you because they definitely don't want you spreading it to everyone that you're taking care of. Or if you're a family member of a healthcare worker. If you are over the age of 70, you will be tested. You will also be tested if you are over, I think, if you have chronic problems and breathing problems. So it's kind of restricted in who they're testing right now, and it's not because we don't want to test, it's just because supplies are in demand. So as we get those, that will increase. I do know that it is, for our area, Augusta area, it is just now starting to peak. They expect the peak to be May 1st. So this next week is when they expect cases to rise dramatically. And in the last 24 hours, we've had 35 more positive cases. The problem is that people have been on lockdown for 2 or 3 weeks now, and they're tired. They're tired of being locked down. They want to get out the house. They want to go do something. So the only place that's open is grocery stores. So you see people packing in grocery stores. And I think we've kind of, the media has given the false impression that a cloth mask is adequate to protect you. Let me just say it is not. And so do not think that that is going to protect you to wear a cloth mask. The whole point of wearing any kind of mask at all is so that if you're positive, it doesn't spread as much, okay? Because right now they've had studies of the virus spreading as far as 13 feet. And so if you try to social distance 13 feet, that's just going to be impossible. So by wearing a cloth mask, it may only be 3 feet that you need to be away from someone so that you don't spread it. However, just know that that cloth mask is not going to protect you. So if you're over the age of 70, if you have chronic conditions, if you're a high-risk person, stay out of the store. Find someone to go to the store for you. Do not go to the store, do not go out. If you need to get out the house, go walk outside, but even there, wear a mask of some sort and keep your distance from people. And it's starting to present in different ways. Sometimes it can be fainting. Some people have just passed out. Some people have had fever. Some people have had stomach problems like diarrhea or feeling nauseous. It's presenting in all different ways. And so you have to assume that the virus is out there. And if you're someone who's high risk, you got to do what you can to protect yourself.
Okay.
Evelyn, I think oh, okay.
Yeah. Okay. What do you mean by high risk?
So you heard Dr. Harper say earlier that somewhere like 2 to 5% of people are dying from the virus. Well, if you look at everyone who gets the virus overall, that statistic is true. But for people over the age of 70, it's more like 10% are dying. And if you're over the age of 80, it's like 15 to 18% are dying. So like the older you are, the more at risk you are. So age is probably the biggest thing. The other thing is chronic conditions. If you have any chronic conditions, especially heart disease or problems with your lungs, any chronic lung disease or any chronic problem, diabetes, anything like that, you are at higher risk. So if you're older and you have a chronic condition, you're at really high risk. It has not really caused a lot of hospitalization in children. However, they think that children are the ones who may be the asymptomatic carriers and passing this around. But since we're not testing kids, because even if they do get it, it's very mild, we don't know. So you have to assume that, like I said, that it's out there and you just have to do what you can to protect yourself.
So let me just share this real quick. So that people can see it. So here's the list from CDC. 65 and older nursing home. We've had a nursing home, Windermere, I think it's called, near Doctor's Hospital with several cases, several deaths. So here are the underlying conditions: chronic lung disease and asthma, serious heart disease, immunocompromised. Those are people with cancer and treatment with steroids and so on. But something that's interesting, severely obese patients also at risk. Of course, diabetes, chronic disease, kidney disease, and chronic liver disease. So as April or Dr. Hartman would say, is that it's huge to avoid any possibility of contact with the individuals in these groups. And those are tested early if they have any symptoms or if they have any exposure to a patient or a person that has had the disease.
Okay, so we're hearing that not only are the folks at high risk, what about the 30-year-old, the 20-year-old who's walking around, just feels bad and next day they're gone? How do they come into the mix? Why is that?
This is a new virus, and I think that a lot of times they don't know. But the thing that is causing the most deaths is that their lungs fill up with fluid and they can't breathe. And so that is the reason that most people are dying, is because of that. And if they do end up on a ventilator, they end up being on the ventilator for weeks. It's not like just a 2 or 3 day thing. If they get on a ventilator, chances are they're going to be on a ventilator for weeks. And I think, like in New York, they were saying 80% of people who are on a ventilator ended up dying. So it affects the lungs in a way that they have not been able to treat.
Okay, Evelyn, tell us how we need to stay away from.
Yes, you want to go in computer audio. Okay, I see Beverly Scholar's head. Can you hear? Yeah. Mute, Shirley, you gotta mute. Oh.
Shirley, mute your phone, please.
Okay,
Okay,
Martha,
Evelyn.
I am going to talk to you about 5 simple steps to avoid getting the coronavirus. The first one, which is the most important one, clean your hands and wash them often, especially when you've been out in public. The preferred way to wash them is with soap and water for at least 20 seconds. But if you don't have those readily available, a hand sanitizer that is at least 60% alcohol can work just as well. Just make sure that you cover every surface of your hands and continue rubbing until they are dry. Number 2, avoid close contacts. Like Dr. Hartman said, you need to stay at home as much as possible. A mask does not protect you. Like some people say, you have to keep the distance between you and other people. And remember that people without symptoms can spread the virus. Number 3, the Center for Disease Control is recommended that everybody wears masks who is out in public. They have an easy tutorial in their website on how to make your own mask. But remember, a mask is not a substitute for social distances. And it's also good to know that you shouldn't put a mask on a 2-year-old or younger, someone who has breathing problems, or someone who needs assistance putting or taking off a mask. Number 4, you need to cover your mouth when you cough or sneeze, preferably with a tissue. Toss away the tissue and wash your hands promptly. If a tissue is not available, you can use the inside of your elbow. Number 5, Clean and disinfect daily every surface that you frequently touch. To include, but not an all-encompassing list, your doorknobs, refrigerator door, tables, countertops, light switch, faucets, sinks, keyboard, even your phone. If after you do all of this and you still think that you are being exposed to the coronavirus, the Center for Disease Controls recommends that you self-quarantine for at least 2 weeks. Back to you, Beverly.
Okay, you probably, I would say probably need to maybe call your health department or your doctor and let them know what's going on so that someone would be able to follow you if you're just going to self-quarantine. Wouldn't you say?
And you self-quarantine, it is not being required for you to communicate to the health agencies because that would clog all the lines. If you have symptoms, then you need to contact your provider.
Okay.
So Beverly, I wanted to share, I think both Dr. Hartman and Evelyn have mentioned the screening. This is the website, the virtual screening. Oh, hold on, let me do the share. Let's see. So the Augusta University is now for the statewide, has been deemed to be the screening facility statewide. So let me share screen, okay? So this is the website right here. So you will talk to a live person, a physician or another health practitioner that will then ask you some questions and will give you guidance on whether you need to be checked, screened, and also whether you're sick enough that you have to go to the emergency room. And this is extremely useful as a first step for anybody who is a little worried. I'm coughing a bit, I'm having some congestion, or even some odd symptoms. One of the symptoms that has come up is you can't smell things. I mean, that's unusual. So you have something different and you want to call, and this is the best way to do that.
You also can't taste. Okay.
Hi, can you
All
hear
right.
me?
I was just adding, Dr. Harper, that you also cannot taste or smell. That's one of the other set of symptoms. Okay. So what about our audience? Do you have some questions you'd like to ask before we move on to the next?
So
our participants?
I have Hope here asking me on the side, when is the antibody test coming? When is the antibody test coming? So, and the reason for that is because they are developing an antibody test to know who had it. Because right now, like I said, we don't have the supplies to test everybody, but there will come a time when they will want to test everybody to see if you had it so they can see if they can trace the pattern a little better. That's in the works. It's not the biggest priority right now, but there are people working on it. One thing I will say to everybody is right now they have really loosened the restrictions on providing visits with your doctor via video like this. So if you have an appointment with your doctor, instead of just canceling, you may want to ask your doctor, do they offer video visits? Because you can get your meds refilled, you can talk to them about other problems you may have that are not related to COVID. And I know that most doctors are offering some telehealth visits now. So even checking with your regular doctor if you need something or you want to ask about something, most doctors are offering video visits at this time. And they don't cost you any more than it would if it was an in-person.
We have a question. I think Judas had a question, and also Anna is asking a question on YouTube. So we'll take Judas first.
Okay. I'm trying to unmute here.
We can hear you, Judith.
Oh, you can hear me? Oh, okay.
Yes.
Two things. I think Dr. Harper was just showing the website, but earlier, I think Dr. Hartman was saying that there's a hotline. Is that one and the same? The hotline
Yes,
that,
it is. What he was showing you was the link to the app, but there is a phone number. And if you give me a minute, I'll get that for you. Or Renee, is it on that site,
Yeah.
the phone number they can call?
Yes, it's one and the same. It's one and the same. First, all you got to do is you Google Express, Augusta Express, and it'll get you there. There is an app, you can do it by phone, but essentially it's a phone number that somebody will link with you, and it's a live person asking you questions and answering your concerns, and then letting you know whether you should be tested. I mean, one of three things is going to happen. You just shelter at home, you know, or you're going to need to be tested, or you need to go immediately to the emergency room.
okay. And do they have the rapid test now here? Do they have the rapid test?
They are able to do a test within, I would say 4 hours. It can be quicker than that, but because they are doing so many tests, I would say that the quickest would be 4 hours and even up to 24 hours. But within 24 hours, you're going to get a result.
Okay. And then the
It
last,
can be faster, but it's just the volume of testing that they're having to do is so high that it just takes a while. Now, if you are a healthcare worker, though, and you let them know that you're a healthcare worker, they'll do yours first, and you'll get a result a lot faster.
okay. One thing that I just want to share real quick. I've been out of work before this started, and I haven't been back to work yet. I've been asking questions, though, of what I'm walking into on the 30th. And the nurse, I'm an RN. The nurses, I know, understand wear masks all shift long. But what I'm concerned about is at the nurses station, they're not practicing social distancing. So that I'm quite concerned, to be honest.
Healthcare workers do have the appropriate mask and gowns and all that. And at AU, and I think most hospitals, they have a designated hall or floor where they have all the COVID patients. And the people that are working with them, they're limiting their interaction, and they do have the appropriate mask and everything. So they are protected. And what we're doing at AU is if we know people are high risk because they've been sick or they're older, they're the ones that are taking care of everybody else. And the ones that are lower risk are the ones that are taking care of the COVID patients. And I think that's all the hospitals are doing that, because we do want to, we want to protect the healthcare workers. And so they are being protective and trying to shift the healthcare workers in a way that is safe for everybody, as safe as possible.
Thanks.
Okay, Anna Reeves has a question. She's asking from the YouTube channel. She has a question about not being able to taste. And she asks, is it like when you're congested and you can't taste, or something different?
I believe it's the same situation. I mean, obviously, we have 4 basic tastes, right? So if you can't taste 2 different sweet things, it's a smell. It's a problem with your sense of smell. So if in doubt, if you have some questions as an individual, it's just something different. I'm trying to eat something and I can't taste it. I can't smell. Then yeah, call the line, the Augusta Health Express line, and they will guide you through that. That is one of the symptoms. Right now, if you have 2 symptoms in certain category of risk, you will be asked to be tested. And then if you have 1 symptom, which is severe shortness of breath, that one alone will get you tested. So yeah, so it's just that you can't taste food, you can't taste the drink, you can't smell things that you could normally do before.
One thing that I want to mention that I don't think we've mentioned yet is that they have found that you are actually the most contagious 2 or 3 days before you start having symptoms, which is why this virus is spreading so fast. Because people are out there, they don't feel bad, they're not having any symptoms, and so they think they're good, and then the next day they get sick. Well, whoever you saw the 2 or 3 days before that are the ones that you expose. So that's why we're really, really encouraging social distancing, because you just never know when someone's going to come down with symptoms and you're the most contagious before you start having symptoms.
So, Dr. Hartman, you did mention that cloth masks or scarf masks are really not as effective for the regular person out there. How do they get a mask that's appropriate for them?
So there's a shortage of masks, and I'm not saying don't wear a mask. You need to do whatever you can to protect yourself. So if you wear a mask, like I said, if someone is positive and they have on a mask, then if you're at least 3 feet away from them, you might be okay. If they don't have a mask at all, they found that the virus can travel up to 13 feet. So everybody needs to wear a mask, because you never know who's going to come up as positive. And that's the best way, in addition to social distancing, to protect yourself. I'm just saying, I don't want people to put on a cloth mask and think that, oh, okay, I can go to the grocery store, I can go everywhere because I'm protected since I have this cloth mask. I don't want people to think that, because that is not the truth. However, everybody wearing a mask and keeping as much distance as you can between people is the best way to protect people.
Very good. Okay.
So let me just comment on that. So, you know, your mask is protecting others against your respiratory pathogen. So if you walk into a facility, a shopping, you know, a supermarket, and everybody's wearing a mask, well, there's going to be less respiratory pathogens in the air and on surfaces in that place, because less of it is coming out of your own breathing. But as far as you breathing in, it's not that good as a protection. In the healthcare setting, there's a specific type of mask that you've probably seen in the news that are short, well, we're short of, which is the N95. That's a respirator type of mask that protects the individual that's wearing it. And that is not recommended for folks out in the community, only for healthcare workers.
Okay. All righty. Any more questions?
Let me just one more comment. Wash
Yes.
the mask. If you do decide to use a cloth mask, and you know, community folks that like masks to give out to family or friends that might need one when they go out. But remember to wash that. The cotton ones are washable. And you know, the other ones can be sterilized. There's a system to sterilize with ultraviolet light in the hospital. But don't just keep wearing it on and on
No.
without washing it.
I would recommend that you wash that mask every day, put it in the dryer and wash it in hot water, put it in the dryer and be ready for the next day. This is not something that you just wear continuously all week long.
We have a question
Don't let
from
somebody
YouTube.
borrow your mask. Okay, go ahead,
We have
Pastor.
another question from YouTube from Dale Matz, and she is wondering where she can get a mask.
Most people are getting them from people they know who are making them, because I guarantee you, I went to the fabric store the other day because I was like, oh, I'll get some cotton. And then I know people who sew, I'm gonna get them to make some masks. There is very limited what's available. So the best thing, if you know somebody that makes them, if you don't, you can use a bandana. You can make one out of an old raggedy t-shirt or cloth, you know, like you just have to get creative and make one out of what you have. And elastic is hard to find, but you can use rubber bands. Like you really just have to get creative with it.
Okay, you know, that's a line of business somebody needs to get into.
There are many people doing it, and some are doing it for a very big profit, and other people are doing it out of the kindness of their heart. So you just hope that you know someone who's kind, I guess.
There is I'm trying to remember, I think it's Fred's Sewing. It's, I think, on Washington Road. They had an ad that they were willing to make masks and distribute it to whoever.
If I may jump in here, if you
Yes.
go to the cdc.org website, they
They have
have
the
an
pattern.
easy, an easy tutorial to
Mhm.
follow. They show you how to make your own cloth mask, even from old t-shirts.
Yes.
So just go to the cdc.org and they'll show you how to do your own mask.
So Dr. Hartman, I wanted to share, you mentioned the number, the phone number. So I wanted to share this here. So this is the site. So here's the number, 721-1852. If you just want a phone contact, if you don't want to be on video with a provider. Here's the website, and that website you can download an app into your phone, Android or Apple. And there are two testing sites. Christianberry has been the one that has been used, but they just opened another one. Where is it?
At Patriots Park.
Yeah, Patriots Park, is that there? Yeah. And by the way, these are appointment only. Okay, you can't just drive in. You have to call ahead and you have to be told to go, and then you have an appointment. They're going to be, expecting you somewhere near that appointment time.
Okay. I just want to mention that AU does have an app that you can actually get to the app and talk with a provider there, and then they will determine if you do need to be tested. So AU, and of course, one of their testing sites is up on Riceboro Road.
Yeah, that's the Christianberry. It's where they play basketball and volleyball for the university.
Mm-hmm.
I've never been there, but that's where they're doing testing. They were doing testing only between 10 a.m. and 12 for a while, but they're ramping that up, and I don't know the exact hours now, but you will be told. And that's the AugustaExpress.org that Beverly's saying that.
It's AugustaExpressCare.com.
Expresscare.com. Okay, expresscare.com.
Okay. Now, it's my understanding that why is it that we have a higher incidence of death from corona in the Black race? Can you elaborate on that? Is it that we have this genetic difference to it? What's going on here?
Can I speak to this? So
Yes.
because and I've had a lot to say about this. I'm on a lot of different committees, but one thing is a lot of Black people have jobs where they were not able to work from home, so they had to keep going to work. Whereas a lot of other people could work from home. Most of the, they looked, and a lot of the jobs that Black people have, they could not work from home. So that put them out there being exposed. The other thing is because of culture or whatever, we're more likely to be obese and have problems with chronic conditions. And last, but definitely not least, a lot of us don't trust the healthcare system. And so we're going to wait till the very end, till we're about to die. We're not going as soon as we get short of breath. We're going to wait till we can't breathe before we go to the hospital. And so it's a combination of things, but it's a lot of it is the chronic conditions, being exposed more, not having the same access to healthcare as other people. All these things have contributed to that problem.
Yeah, I appreciate Dr. Hartman sharing that. Now, as far as genetics, we're not sure yet. There's so much data being collected, so much things we don't know about this disease. But, I wanted, once again, to share something here because our two counties are very ethnically different. And if you can see this map, if you hover over this map, look at the number of cases in Columbia County, 1 death and 97 confirmed cases, and look at Richmond County. It's about 4 times more confirmed cases and 10 times more deaths. So there's a socioeconomic component that involves, of course, ethnicity and race, and we're not understanding everything now. And I agree 100% with Dr. Hartman as far as what the factors are that we're looking at as far as the racial issue with this disease.
Okay. All righty. Any more from you? Any more questions from YouTube?
Yes, we have one more question. It's asking, where does Dr. Hartman practice and what is her field of study?
I am a pediatrician, so if you're over the age of 18, I'm sorry, I will not be able to take care of you. However, I do work at Augusta University, and I am doing telehealth visits. So if you have a child and you would like your child to be seen, you can schedule with me. You can ask for me specifically or any of my colleagues, but I am a pediatrician. So unfortunately, if you're an adult, I'm sorry, I can't help you.
Okay. Anyone else?
We don't
Okay.
have any more from YouTube.
Okay. So let's hear how can we keep ourselves, we talk about prevention such as social distances, wearing your mask, being very mindful and conscious of what you're doing, washing your hands, and making sure you go to the grocery store when you come in. You want to make sure that you're cleaning off the stuff that you bring into the house, making sure that daily your antibacterial off your tops, your steering wheel, things that we don't even think of. But as long as you're touching outside surfaces, your doorknob when you enter your house, you're bringing it inside. So we've got to be mindful of what we're touching every day. Now, Anna, can you give us some more advice? How can we stay healthy? What can we personally do? Not, we talk about the preventive measures now. What else can we do as individuals to stay healthy and keep our immune system going so that we can really be able to fight off, should we be faced with COVID-19?
Of course. Hi. First of all, we have to calm down and believe that God is in control, right? He's in control. He's the owner of universe. He's our creator, and he knows what's going on. So that's the most important thing, to take stress away, rely on God completely. And another important thing, we can use natural stuff given that God give us to take care of ourselves, to boost up immune system. So some recommendations that I follow every morning, I made this cup of water with lots of lemon. You could take the whole lemon, slice it, put it in the water, and hydrate yourself all day long. I know people in the South, they love to drink cold water, but warm water hydrate you better, especially if you start having any respiratory symptoms. Drink a lot of warm water with lemon. It's not only delicious, it's contain a lot of vitamin C. You can use natural stuff from the health food stores to boost up your immune system, such as vitamin B complex. There is different type. You could research and pay a little more and get better quality vitamin B. Something that our body do not produce. If you're vegetarian or vegan, you need that supplement. And if you still eat meat, the way they produce the meat, not enough vitamin B is in meat sources as well. So it's better to take that supplement. Also, vitamin D. There is a pandemic in this world. Despite that we live in a sun state, somehow everybody is vitamin D deprived. And it's correlated to many, many problems in your body. And especially it suppresses your immune system. So vitamin D every day. It's like an oil, very pleasant to taste. It's like orangey taste, and it's not expensive. I take 10 cups 2 or 3 times a day, 10 drops 2 or 3 times a day. Natural antibiotics, such as cayenne pepper and garlic. So I take it daily to help your body fight the disease. There is another source I recommend to everybody, echinacea. So invest in yourself, boost up your immune system, spend time outside on the sun, breathe fresh air, go for a walk. If you're working from home, make sure that you don't spend all time sitting down, because it slows down your circulation, it stiffens your joints, and you name it. You have to be active. There are so many tutorials, so many videos online that you could follow, like yoga for beginners, any exercises according to your physical condition you could choose. There are so many. So boost up, eat a lot of fresh fruits and vegetables. Avoid refined sugars. I mean, majority of people know what is a healthy lifestyle. If you don't know, there is so much information about that. Just follow this, study, educate yourself, and start living healthy life.
Okay. I love I love that. When you talk about exercise is not only just good for, of course, improving your joints and motion, but it also helps to boost your mood. We're listening to all this negative stuff. We need something that will bring us a spirit of peace. Well, your mood, your thoughts that you have, all of that can improve just by exercising. So it's important that we exercise not just for your joints, but to improve your mood. It also helps you to sleep. When you have a good walk, you come back home, and at the appropriate time, when you go to bed, you will relax and go to sleep. Okay.
I agree with that 100%. Can I add something?
Yes.
Not only exercise improve your mood, there are so many other factors. And when you're watching a lot of media and you're bombarded by all that information about the deaths and people getting infected and people struggling to survive, and it's a very negative, crazy information coming from us to us from media, which also we have to postpone all our plans and future dreams, because I'm pretty sure the world is not going to be the same after what's going on right now. It's going to be different. It's very stressful because, you cannot think about your future projects. You have to stop right now. And maybe that's the positive side of coronavirus, and think about important things. So back to stress. What is affect our mood is our thinking. If we dwell on negative and the craziness, what's going on in the world, and feeding ourselves with this negative information, we're going to be affected. We're going to get depressed. Plus staying all the time at home and not seeing other people, it's all affecting us. So I would recommend think positively, dwell on the most nurturing, positive thinking. Start your day with of making a list. What are you grateful for? What are you grateful to God for? Praise the Lord all day long, because we have nothing to fear. He's in control. Back to you, Beverly.
I do, really do. That can really make a difference. Just look around you and you can see why you have so much to be thankful for. And so I appreciate you telling us that.
I have a comment.
Yes. Oh, well, thank you. We have Sister Shirley with us. Go ahead.
Yes, you do. You do have Sister Shirley with you, and I represent the older people. We're hearing all this. We're
Good
hearing all this.
representation.
We're the ones that are going to get it and die and save everybody because we're going to die, right?
No,
I know that's not right, but I'm saying when you a lot of older people are frightened right now because the nursing homes are not being monitored. They're finding a high incidence of this number 19. That's what I call it. I don't get into the corona stuff. I just call it number 19, number 19. And it is killing some of the elderly people. And you have people who are panicking. They're dying without their loved ones. They're being in, just like living in prison, because of this virus. And the people aren't allowed to see their families. Some of them are dying. They didn't even know they were dead. They're finding them. It's just so much bad news out there for so many senior citizens. And No, I go walking every day if I can, and I leave my windows open, and I do the health food stuff as much as I can. A lot of us live on budgets that we can't really go buy a lot of these products or foods that everybody seems to think that we can just go buy them. No, some of us need to know where to go buy stuff, you know, like what stores. Some of us don't have transportation to go buy things. Some of us don't have the strip to even bring the things in the house once we buy them. So those are some of the things that affect the elderly when we are able to go out. You know, I can't get 24 bottles of water because I can't carry it. So what I have to do is get somebody at the store to get it. And then when I get home, I open it up and I take in 6 bottles at a time until I get them in my house. But
Wow.
in order for me to get it in there, that's what I have to do. Because you can't find the gallon, you know, the big gallon jugs. Everything now is like in the 16-ounce bottles. Before you could go and get a gallon jug and you could bring it in. Now you have to buy water with all these bottles. And it's difficult for some of us to even pick them up. So that's something that, you know, if you can help out somebody with that, or just take water that's already, that they can put in bags and just give it to them so they don't have to go to the store and buy these big things of water that they can't carry or put in the trunk of their car. Some people in the parking lot see somebody struggling, they'll help them. But once you get them home, you still have a problem trying to get them in your house or even carrying groceries. So I don't know if anybody's ever heard anybody complain about this, but I know I went through it. So that's why I'm just saying, sometimes you need somebody to just make a water run for you. Do we have any of these services being offered to any of our senior citizens in our church?
You know, I just want to say this, and unfortunately, we sometimes forget some of the unique challenges that our older folks, you know, struggle with each day. And we just need to, as brothers and sisters, and as human beings, just be mindful so that we can be aware. We need to adopt each other, if you will, so that, okay, I'm adopting so-and-so, and therefore I'm going to find out, build a relationship with that person so I can meet those needs. When now you're telling me this, so that means that I have to take that, I should take that into consideration. When I go to get water, I need to get some water from Miss Shirley. You know, it's important that we have relationship with our folks so that they can feel comfortable expressing some of the challenges so that we can help them to do that. A lot of people are having challenges, and I'm so glad that you felt comfortable with us to let us know that, because I mean, you know, I'm one of the old folks, Shirley, but I'll go get your water.
Well, I'm one of the old folks that can get their own water, and I know how to get it in my house, but I know other people don't.
But there are others.
Yes, there are others that are having problems. They can go shop and they can do stuff, but they can't bring it inside because it's too heavy, or they got to go upstairs. And you know, it's just a situation where not everybody has this problem, but some people do that live alone, that don't have anybody visiting them, because some people don't have company. They don't have people coming by. They don't have people asking them, do they need something? They're locked down in their apartments because some of them live in areas where you really can't be opening your front door because you don't know who's trying to get in your house now. It's a lot
let me just say, Shirley, that and for anybody who knows any older people, we have to know in order to help. And so we need people to not be embarrassed to say if they need help. And as time goes on and people are out of jobs and stuff, there's going to be people who need food, who you maybe would have never thought, oh, I never thought that they might need food. Anything that people need, that's what our church family is for. And we can find people who can help. We just need people to let us know. Because we can't go visit. Now is not the time that you can go visit someone who you know is alone at home. We can't do that, but we can call and we can reach out. And like Beverly said, we can all adopt somebody, but we have to know. So we need people to not be afraid to say when they need something. That's the biggest thing. We all have so much pride that it's hard to say, hey, I'm having a hard time paying my light bill, or I'm gonna get unemployment. I just haven't been able to get it yet and I need help. that's what we're here for. We can help, but we need to know. And that's one thing that we're a family. We are a church family, and everybody, anyone who's listening to this, just let us know. We have people who are more than willing to help if we know what to do. And there are things that we wouldn't have even thought of, like I wouldn't have even thought of water, but there are things that seem so simple to other people that are not obvious to us. And so we really need them to let us know when something's going on.
And can I add to that? I had a email from Elder Harper. I'm under his people, I guess. I don't know how that we've been broken up into groups.
Yes.
And I appreciate you. Yeah, I appreciate you sending me that that email, letting me know that I belong to you now. So if I be calling you,
well,
who do I belong to?
I belong to Elder Harper, so I'm gonna have to call him when I can't bring my water.
Absolutely, absolutely. I was pulling up my list here because I remember I had texted you on your phone.
Yeah, you did, and I appreciate that.
But it has to be more than that. It has to be you feeling comfortable reaching out to us and my family that we can combine help. It isn't like Dr. Hartman says, time to sit down and visit in the home, but
Right.
At the door. The social distancing issue is also a time base. So if you casually pass somebody for a few seconds, that's not the same. And they're saying at least a minute or more of exposure, close encounter exposure. I also wanted to say a practical thing. A lot of supermarkets are opening specifically for elderly folks, typically early in the day, like 7 to 8. And nobody below a certain age can shop at that time. So that's your time to shop safely without being exposed to younger folks who might have the virus and not even have the symptoms. But I appreciate you sharing that, and we'll talk some more when we're done with this visit. But definitely reach out to the elder that has been assigned to your group. And we can't solve everything, but definitely we will try our best, and also pray for you. And some quick visits will be done. I assure you of that.
Well, thank you. I really am good, but I just know that some people aren't, because if I need you, brother, since I'm yours, I'm going to be calling you.
I have some bottled water I can offer you right now in the big jugs, the gallon jugs. I got some of those.
Oh, well, I got some too, but they're little, and I was just trying. If I run out now, I'm gonna call you.
Okay.
I'm so delighted that Shirley, that you share that with us. Let me ask, because I am in the dark. How did you determine under what auspices are people assigned? Is it to elders, or who are they assigned to?
All I know is
I
belong to Elder Harper. He let me know, and so I'm just letting you know that I know who I belong to now.
That's something the pastor should address.
Yeah.
Okay, Pastor, would you let us, because there's probably people here that are waiting for their phone call now, to let them know who they belong to. I'm old enough that I could belong to someone. So
Well, it's so good to be part of this church family. It is a wonderful family. And first of all, we do belong to God, all of us. But we are also called to take care of one another. And that's what we decided to do as elders. We got together. We thought, hey, at this time, we really need to check up on other people. And so the elders divided all the members between the elders. So Roddy did the division for us, and so the elders will be calling if they haven't called members yet. And I'm also trying to call members, but I can't get to everybody as fast as we can as a group. So I appreciate the wonderful group of elders that we have that are working together to reach out and to ask people if they need something. But just like it was mentioned by Dr. Hartman and Dr. Harper, that we need to hear from you too, because we are called to carry one another's burden, but we cannot carry unless you share it. So we want to call the members to share the burden with us, and then we'll try to figure out how we can help as the church also to meet the needs of the people where they are.
So this is not just for the elderly, it's the whole active church membership. I wanted to share that with Beverly, if you can see that. If you see the name there highlighted, Robert Thompson is your elder. So we all
Who
have
is?
this list. Robert Thompson, right at the top. You see it?
Okay.
Okay.
I love it.
And also Joey is there for him too. So that's your elder that's gonna pray for you and also reach out to him if you have any concerns.
I think that's a wonderful idea. I really do. I really do. Now, I think someone is indicating to me that maybe Judy need to ask another question. Judy, unmute your phone. Okay. Okay. Well,
For some reason, I cannot unmute Judy. I don't know if she can unmute herself.
Hi, am I unmuted?
Okay.
Yes, you are now.
Okay, you guys have to excuse me. This technology stuff is I'm learning. But that list that Dr. Harper has, I was just wondering because I know the encouragement ministry has a list, and I've been going down the encouragement list. And in addition to encouragement list, I know is a whole family. So there's also the church directory that I use. But this sounds like this is a new division that I'm gonna need to know about too. Second thing is, Shirley, I'm glad that you started this topic because this is near and dear to my heart. Some of the sick and shut-ins would also appreciate meals. It wouldn't hurt to make meals and drop them off. You don't have to stay long, but just a matter of dropping off meals. I know that helped. That's been helping too.
okay. So you would indicate to us, Miss Judy, who are those that would be in need of meals? Would you be able to tell us that?
I can do that. Yeah. Right now, I know the Martins have been doing, but there'll be more. A lot of times when I call folks, everybody's saying they're okay. They haven't identified a need. But as soon as I do and I come upon that, more definitely I'll let you guys know.
Okay.
So
we have some food in the
pantry.
I forgot, community service. So we can use that, make some boxes with canned food and cereals and just deliver them if, we need to use those cans.
Okay.
So Judy, there's you.
To be able to do that.
Who's my, Leo Smith, okay.
Leo Smith.
Yeah, I've been hearing from him. He's been doing his job, he's good.
Everybody here. Anna, you're under Robert Thompson also.
Yeah, I saw.
Dr. Hartman, it's alphabetical. So Dr. Hartman is under Greg.
Oh, alphabetical. Okay.
Greg Fowler. So, but Pastor, one of the things that I feel, I did, went to the directory because they're all in the directory, and I texted everybody at least to let them know. But it's been about over a week now, and I haven't heard any concerns. So maybe we haven't spread this plan out so that people know.
This is my first time hearing it.
If your elder hasn't called the person, then they don't know yet. So maybe we need to encourage the elders to do a reach out and let everybody know that we have this plan in place.
Also,
I think that's a good idea because, of course, I had no idea that and I really commend all of you for doing that. So yes, even if you did, maybe for whatever reason, maybe we just need to do it again to make sure that they know what's going on. I think that's a very good plan that you all have come up with.
Also, Can I add to that?
Yes.
Leo did contact me and we talked, but I didn't realize that he was assigned to me. So when you talk to folks, let them know that you're specifically assigned to them. I just thought he was doing a friendly deed. You know how everybody's been calling to check on me, which is a good thing, but I didn't realize that they were assigned. So let folks know when you call them too, that you are their elder. All righty?
Okay. All righty. Anybody else with specific questions? I think we've had a really great evening. And
I have something else I'd like to say, please.
Okay,
About
please.
the lot of stores do not have the disinfectant or the hand wash, you know, the alcohol wash that you can just spray your hands with or wash your hands with. So how do you make yeah, hand sanitizers? I'm sorry, I'm having an Alzheimer's moment, you know.
Don't claim that.
Whatever. But how can you make an at-home or a DIY, what is it, DIY? Do it yourself hand sanitizer?
I actually looked this up.
Besides soap and water, I know about that, but I'm just saying.
Yeah, soap and water.
No.
I made some for myself, you know, when I realized it's very expensive to buy on Amazon. So it's all the stores are empty. You can buy nothing unless you're very early standing in line to get into the store. If you have an alcohol, 70% or higher alcohol at home, you can either dilute it with water. I don't remember the exact proportion, but you could use the plain alcohol and put it in a little bottle with a spray and use it as a sanitizer. For the better effect, I would recommend essential oils. They are strong antioxidants, plus they have very pleasant smell. If you have, which one I used? I have a collection of, I have essential oils. I just put some of them, if you look up some essential oils, which you could buy at the Sprouts, you know, their price varies, and the property of essential oils you could look up online. They're all very good. So 10 or 20 drops in a small bottle, maybe, I don't know how many ounces that would be.
About 6.
No, I think it could be 8 ounces, yes. Essential oils. And I take that bottle with me. I have it in the car. I have it in my purse. I go to the store. I have it in my pocket. Before I touch the car handle, I spray my hands, wipe it around, sit down. I spray my car keys. I spray my cell phone, and I spray the steering wheel, and I drive. So I believe it should help, because alcohol, you know, if it's strong alcohol, it kills the bacteria and viruses.
So let me just say that it has to be at least 60% alcohol to kill the coronavirus.
Yeah, I said 70 and more.
You need to get the recipe, because you don't want to dilute it too much. So you have to get the recipe, because it has to be at least 60% alcohol to work. Otherwise, it's not going to work.
It's not easy to buy alcohol, but you could order it on Amazon. It'll take time for them to process. You could order the big gallon. It costs about from $24 to $30 for a gallon of alcohol. And you could.
The last I looked, it was not going to be delivered until the end of May on Amazon.
So that's what they say when I order mine. Yeah, that's what they say. They give you, but they could be faster than that. So to give you a little hope.
So
Okay,
Dr. Harper.
I'm showing
Dr.
a
Harper.
website, just one website, that the key is the ethyl or isopropyl alcohol. They're different, but if you're going to dilute it, you have to start with a high concentration, like 90% or higher, because then it's going to be diluted. Now, this is a little complicated. I just pulled this up quickly, but I've heard of folks using aloe vera gel and essential oils, like Anna was saying. And you do what you can, but the alcohol is the effective product. That's the active product. That's what's going to kill the virus. And when all is added in, as was said, 60–70% of the product in order to be effective. So
and some essential oils, they have antibacterial, antiviral properties. So it's very, very good and healthy from us. And it's a natural product that God gave us. I think we should take advantage of it in this time. Especially
Where can you get the alcohol?
on Amazon, but it will take time. Just try to find it online because it's impossible, almost impossible to buy anywhere right now.
Is that
But
doctor?
you also, I don't know, you tell me your opinion. What about the peroxide? Because I saw some peroxide in the pharmacy. Can you use it as a sanitizer?
No, I don't believe so. I think it can be irritant to the skin also. So hydrogen peroxide, although it does have some antiseptic properties, it's more for cleaning wounds and it's more medical than using it for sanitizing or killing bacteria or viruses.
Thanks for the
Russian,
recipe.
as Russian, I was thinking vodka, but apparently vodka is it's only 40 degrees is the highest one, but it's better than nothing, I guess, you know?
We're talking about
Might not walk with it, they might drink it.
we're talking about how things have
Sanitize your throat,
changed.
yeah.
That's too much.
Okay, Anna, stay off the vodka.
I want to tell you, like we in Russian, and Pastor Romanov, I don't know if he has the tradition in his family. In Russia, when we cook soup, we eat fresh garlic. We clean couple of garlic cloves, 3 or 4, and I just bite garlic and I eat soup. So fresh garlic, fresh onions, they're your friends.
That's
especially
right.
with social distancing, should be easy.
Yeah, we do that. I just have to remember not to do it before prayer meeting.
Well,
Okay.
let me just say something as far as how things have changed. You mentioned alcohol products. Some you've seen in the news probably some companies that make alcoholic drinks have shifted their production to hand sanitizer. And the other news that's recent is some of these companies that have meat products are shutting down, and now supermarkets and shoppers are shifting to plant-based products. So there's some good throughout this that we're probably going to end up a little healthier in that way.
So you have to, they got to retool
since
their
you brought-
businesses. They have to retool.
Dr. Harper, since you brought up that, is there a possibility, we use the term that the virus jumped from animal to humans. With what's happening in these processing plants,
We don't
where
know
people,
exactly.
employees,
We don't have any hard evidence that it was actually, they're saying bats in Wuhan, China. We don't know exactly if it was that or not. It is a mammal, the bat, and as other animals that are commonly eaten, but there is no evidence yet that it can transmit through food. Some suspicion now is that perhaps it was not an animal, but a laboratory in Wuhan that was experimenting, and one of their workers may have gotten infected. We don't know, but there is no evidence that it's transmitted through food, like food poisoning at this point.
Okay. Of course, it can be transmitted when you on food, in the sense like it's on your hand and it gets transmitted to the grapefruit or the apple and you don't wash it.
Yeah, it's possible that in a package, right? A package that's been handled by somebody with the virus. Once again, I have to remind everyone that it is a viral load. A few particles of virus may not be enough to infect you. So we don't know. Some folks are recommending when we get our produce and our shopping that we wash it at home before we put it out. I'll leave that up to everybody's decision.
It just makes good sense, since you don't know, that you wash all your fruits and vegetables before you actually use them. So I see Miss Vera on my screen. Do you have a question, Miss Vera?
Hi, I had a question earlier, but it took me a while to get back in. I just want to thank, I think I know my elder. He's reached out to me several times, and I just wanted to give kudos to that program that you guys have set up. It really means a lot. I've been listening, but I had to go back in and come back several times because I'm not electronically whatever, technology, whatever. But anyway, I'm on. I appreciate what you're saying. And I believe it was Friday morning that they said that I heard in the news that they had come up with some drugs, I think 2 of them that looked very promising. And I'm wondering if any of the doctors or anybody know what's going on with that. And I can't remember the names of the 2 drugs, but I know that that comes out every so
Okay,
often.
Dr. Hartman or Dr. Renee, could you address that, please?
So the question is, are there drugs that are available to treat? Is that what you're asking?
No, we
Well,
know
that's,
that. Go ahead, Bevan.
no. You know, we've been hearing about the hydroxyl and all of that. So I think that's what she's referring to, that they're out there, but as to how effective they are, and they've been tried on some patients. Some patients have responded depending on how much their viral load was. So can you just kind of clear that up for us?
So the thing about this is it's a virus. So when you think about this, the way to think about the difference between bacteria and viruses is in your bloodstream. If you have a blood vessel and you have blood, your red blood cells and white blood cells floating around in your bloodstream, when there's bacteria, they're floating in the bloodstream with everything else. And so when you take an antibiotic, it gets absorbed and it goes into your bloodstream and it can kill the bacteria. Viruses are different. They actually go into the cells. And so you take these medications and they float around in the bloodstream. They're not going, most of them aren't penetrating the cell to cure the virus. And so it's almost like the virus is hiding. So what they've been looking at is they've been looking at these antivirals that they use to treat things like HIV and other viral illnesses that they've had some success with. And they're experimenting with them, but they're only doing it for the people who are about to die because they don't want to make you worse by, every medication that you take has side effects. And so just because it may help kill this virus, it may also kill the cell and some of those cells you need. So like there's lots of side effects. It interacts with other medications. You have to be really careful with it. So they're only using them as a last ditch effort. But some of the antivirals that they have tried, they have had some success with. But right now, I don't see it going these drugs are extremely expensive, number one. Some of them like $1,200, $1,500 for one pill. So they're very, very expensive. And I don't see them right now because it's so experimental. They're only using them for people that are as a last ditch effort. Going forward, I'm sure there will be many trials where they will try to see for some viral infections, is there some of these that can work? And so right now, everything is experimental. This is new. Most viruses, we just say, oh, give your body, let your own natural immune system fight it and you'll get over it. And I can say that one of the best ways to kill a virus, what happens when you get a virus? What's one of the first things that happens? You get a fever. That is your body's natural way to kill that virus. But one of the first things we do is we take Tylenol or Motrin or something and we knock that fever out. So that's our own natural defense. And so one of the first things that we say, especially for kids, is parents call and they say, oh, my kid has a fever. And I'm like, great, that means their immune system is working and they're trying to kill that virus. So unless they're just miserable, let them run that fever for a day or two, that kills off the virus. Probably by day 3, they're a whole lot better. And so we have to be careful. And this is one of the things that, like what Anna was saying, that we have to support our natural God-given immune responses and not be so quick to fight against what we have. When you cough, that is a natural immune response to get rid of stuff that's in your lungs. Why do we suppress our cough? That's not a good thing to do. We're so quick to fight our natural responses. When your nose runs, that's your body's way of getting rid of whatever's there, just excreting it, getting rid of it. But we want to stop it. We don't want our nose to run. We don't want to have a fever. We don't want to cough. But those are our natural God-given immune responses to fight off these diseases. So all I'm saying is just think about it before you try to treat one of these. God has given us an amazing way to fight off illness. He has given us immune systems that are so I mean, I just can't even find the words to express how marvelous they are. And we need to not be so quick to fight against them, but do the natural things, make sure we're eating healthy, making sure we have the vitamins and nutrients and hydration and everything we need to stay healthy.
So
Oh.
as Dr. Hartman was talking, there's a website called drugs.com that kind of keeps up with all the new developments. And there's about a dozen different drugs being investigated, but they're all investigational. The ones that you've heard on the news are hydroxychloroquine and
Yes.
azithromycin. Neither is an antiviral. So we don't know exactly how those would help. And there's been just some cases that reported that got better using these drugs. But what happened as soon as that came up, you couldn't find the drugs. Yeah, they were just wiped off the market. At Augusta University, for the severe cases that have been on ventilator for a long time, they are using an antiviral called remdesivir. And that is extremely expensive, and it has helped, and they use steroids sometimes. But again, those are last resort cases. We don't have a good way to treat this with antivirals like we do for flu. We have several drugs for the flu. So that's, of course, being ramped up. There's a lot of research and development, but we have to give it time. Some of these drugs may not be safe, may not be effective, and we can't just jump to conclusions. I think your body's health is what defends you against the virus. And if you're in better shape, you're going to do better if you get an infection.
Okay. Anyone else? We're about to wrap up because, of course, I do want you guys to have a break before you tune into our evening program at 7.
I have a question to
Okay.
doctors because chemistry, is there any difference between propylene alcohol or isopropyl alcohol? Is it the same thing? Because I was trying to find the difference online and I couldn't with a good explanation. Propylene alcohol, propylene glycol or isopropyl alcohol, is there any difference?
They're different products. Ethyl alcohol is the drinking alcohol. And then there's isopropyl alcohol. Now, ethylene glycol is a different product. It's not even
Propylene glycol. Can I use it as a sanitizer or no?
No, I don't think so.
No.
It has to be
You need that.
isopropyl or ethyl alcohol. Those are the two alcohols.
Isopropyl or ethyl alcohol. Yeah, and they're the most.
Because you want it to evaporate. It won't evaporate if it's the other.
All right. Okay. Thank you. I'm glad.
Yeah, use the right product. Don't something that has hole at the end might not be enough.
It was very hard. Wasn't able to find the answer online. I Google different sources, try to look for it for an hour. I couldn't find. So I'm glad for the bright brains that we can pick on. I have another question. So are we going to address the fact that, what is the positive side of coronavirus? And I hear about, it's an information coming about the end of the times. Do we have to leave the cities? Are we going to address that in this seminar?
Pastor David.
I think this will be a time for maybe a different discussion where we focus on the spiritual things of everything that's going on in the world. And maybe it's a good thing to schedule some time and do. But for this time, we just want to focus on medical. And although we could also address it, but because of the time, I think that we should leave it for another time because we do have a program coming up at 7 o'clock. So. But thank you for that question. It is a good question.
In closing, I would like to go ahead and thank all our panelists, Dr. Harper, Dr. Hartman, Evelyn Pereira, Anna Sanchez, and of course, all our friends and participants. It's been a great evening, and we thank you so much for your participation. Hopefully, most of us have learned something new out of this. And in closing, as we get ready for our next meeting at 7, I'd just like to leave you with some hope, if you will. Human love may change, but Christ's love knows no change. When we cry to him for help, his hand is stretched out to save. The Lord is good unto them that wait for him, to the soul that seeketh him. Ye shall serve the Lord your God, and I will take away sicknesses from the midst of thee. Exodus 23:25. Pastor, if you will pray for us.
Sure.
Mhm.
Our dear Heavenly Father, we are so thankful again for the words that we were able to hear, how we can do things from our part. Thank you for creating us with ability to think, with ability to reason, with ability to comprehend and to live in the society that we do. And thank you for our body, that you have made such wonderful bodies that can also protect with the immune system from viruses, and we appreciate what we have heard, how we can strengthen this at this time. We also want to ask you that you would draw us closer to yourself during this time, and that we will be focusing on you as we can control our thoughts and our minds, that we will choose to focus on you, the blessings that you have already given us, and the hope that we have, nothing in this world, but the hope for eternal world that you're preparing for us. May we share it with others who do not have this right now and desperately seeking for some answers and for some hope. We praise you and thank you in Jesus' name. Amen.
Amen.
Amen. Stay sheltered and stay safe. Thank you. Enjoy the rest of your evening and weekend. Till I see you. Hey, I've got a big air hug. Everybody. Okay. Bye.
Bye. Have a good day.